You want higher, more prominent cheekbones without having to get surgery. One technique that is gaining popularity right now is called zygomatic pushing. The idea is based upon joint suture theory. A consistent pressure over time can lead to subtle changes of your scalp. But does it actually work? I'll be breaking it all down in this video. The theory behind it, what the evidence says, and how do you do it correctly, and what kind of realistic results can you actually expect from doing it. So firstly, what is zygomatic pushing? It is a method of applying controlled pressure to your zygomatic bones, what we call the cheekbones. The goal is to stimulate these sutures. The theory suggests that bones, even in adulthood, retain a small amount of flexibility. So let's look at what the evidence says. Here's everything we currently know about whether zygomatic pushing works. Firstly is the anthropological evidence. In ancient civilizations that had diets that required heavy chewing, we see wider, more robust zygomatic arches. This suggests that external forces, like chewing, can influence the bone structure of your face. What is the modern understanding? There is some biochemical logic behind this theory. Consistent forces can influence bone remodeling over time, as we see in orthodontics. However, the flexibility of your zygomatic sutures heavily decreases with age, so the potential for significant changes is limited, especially in adults. This technique will work best for younger individuals, particularly those in their teen years, maybe early 20s, but far less so beyond 30. So the bottom line, while there is some theoretical basis, the evidence is anecdotal, and the results, if any, are subtle, especially as you get older. So with that in mind, how do you perform them? You want to try zygomatic pushing. Here is how you're going to do it effectively and safely. Firstly, begin by washing your hands. You watch skincare guys, you know why. Then, find your zygomatic bones along your cheekbones right here. Using your thumbs or index fingers, you want to push in the direction from under your cheekbones to your temples. Some people prefer to do this method from inside their mouth. If you go inside your cheek, you can feel the bottom of your zygomatic bone right there. Hold the pressure for 30 to 60 seconds, then release it, and repeat that 2 or 3 times per session. Practice this technique once or twice daily, as overdoing it will not speed up results. It could just cause irritation and soreness. Make sure when you do this, you have a straight spine, you are sat or standing upright to ensure that you have proper alignment of your face and neck. So realistically, what can you expect from doing this? For younger individuals, you might notice slightly higher set cheekbones and potentially improved symmetry on your face, normally in around a 3 to 6 month time frame. For adults, it may take even years to just see subtle changes. Up to you if you do it or not. Understand that the effects are small at best. Zygomatic pushing is not a quick fix or even a guaranteed way to transform your face. However, it is a low-risk technique that is worth trying if you're patient and realistic. But you need to keep in mind these things of what to be careful of when doing so. Make sure you are not overdoing it. Make sure you're applying even pressure and avoid creating any asymmetries. If you have any pre-existing conditions like TMJ, or just avoid this one as a whole. And remember, if you're over 30, the results will be negligible due to your reduced suture flexibility. Zygomatic pushing is simple and low risk, so it's worth a try for those who are up for it. As always, let me know if you have any questions. Best of luck, gang.